Hello, this is Mr. Smith, and today we'll be looking at an academic economics unit number 4, the financial system. We'll be looking at the actual system itself and the tools of finance and some other things like interest, for instance, and investment and things like insurance. So today we'll be looking at the financial system. So three of the topics we'll look at would be intermediaries and other types of institutions. These are the places in between savers and borrowers, things like matching savings and investment spending and loanable funds and the marketplace for that, which are all important to large-scale consumption. So first of all, looking at financial intermediaries, banks, of course, are the most common ones, and here you can see a picture of PNC, which is throughout Western Pennsylvania. Banks cover deposits to loans and thereby increase access to capital by serving as a financial intermediary between savers and borrowers. So they take deposits and then they loan the money out. So this creates an investment in the economy. So if you put $1,000 in a checking account and they have a reserve ratio of 10%, they only keep $100 and they loan out the other 900. So in a way, you're investing in the economy by helping someone else get a loan for a car or a house or expand their business. And so that's a major function of the financial intermediary. They repurpose the funds. So they take the money from savers and they give it to borrowers. The banks and other financial intermediaries, they collect the loans back with interest because that is their fee for taking a risk and managing the loans. And then they give some of that back to depositors, savings accounts, certificates of deposit, other types of investments. And they give it back to those people who have those more permanent types of accounts because you need to have so much money in savings accounts, certificates of deposit for a certain amount of time. And so because they're taking that money from you over a period of time, they give you a reward by giving you some of the interest. If you have, that also takes place if you have a large volume checking account, for instance, as well. That's possible. But in most cases, checking accounts, for instance, they don't offer interest, and that's just because they're providing you with this service, basically, of holding on to your money, which is insured through the Federal Deposit Insurance Corporation, or FDIC. So even if the bank gets wiped out by a tornado or robbed, or if it fails as a business, your money up to a certain amount is insured. And so the bank is providing you with this service, so it might not necessarily provide you with some interest. But the bank itself is providing a service to the entire economy by taking this saved money and loaning it out elsewhere. So the ability to save is, of course, incredibly important. Whenever we look at the gross domestic product, or the value of the total production of the economy, or the total income of the economy, the components that are put into the gross domestic product include consumption, investment, government spending, and then, of course, basically the difference between exports and imports. That would be a positive number if the exports are greater. So all those are included within the gross domestic product. But in this section, in the financial intermediaries and the financial sector, we're going to be specifically looking at that investment spending. So savings is defined as income that is not consumed, obviously. They're not spending it, they're putting it aside. Investment is made into capital, so factories, machinery, business, investment in education, because you can get loans for that and so on, and training. So this is going to increase productivity and efficiency. So that's going to lead to greater output of goods and services. And so with a greater supply of those things, the prices drop and there's a greater standard of living because you can afford more things, and it provides more jobs. So the types of investing, stocks, bonds, mutual funds, other types of things, are not necessarily classified as investments, but rather as savings because they're just putting money aside. They're indirectly investing. So savings from this perspective make sure that this money can then be taken by the financial intermediaries and loaned out, which can be then used to purchase capital. So capital purchases can be made. So even though you're technically making a savings, you're saving money, you're indirectly investing in the economy. So savings is what households do. So the level of savings, how much savings is occurring, depends upon a few things. The interest rates, poor expectations for future growth. So people are going to save more money. Oh no, the economy is going to be bad, so let's save. More disposable income, so people get raises, they can put more money into savings. And the likelihood of reduced return through regulation or taxes. Maybe I'm not going to get as much for investing in the long run, so I might as well save it instead, which is basically indirect investing. So we then have what is known as the marginal propensity to save, or MPS. And this is the percentage of after-tax income, so after you get your paycheck, after the taxes are taken out, that an economic agent will choose to save. That's what MPS is when it's referred to in economics. So the greater the MPS, the more savings households will do as a proportion to each additional increment of income. And you'll notice they have a picture of a savings bond here on the screen. Bonds are a type of savings. They're an indirect type of investment. Savings are used to fund investments. You're just locking out your cash by purchasing this bond. You've given it to the government, and they in turn are going to invest it by they themselves buying goods and services, building things, or they're going to, through subsidies or maybe even a loan themselves to a company, are going to have capital investments occur. So if people are putting money into savings accounts and certificates of deposit and bonds and other things like that, it means that they're saving a lot more than they otherwise usually would. So in economics, the loanable funds market is a place where savers and borrowers are able to establish a quantity and price, and in this case, the price is going to be the interest rate. And so you can see on this chart, this will look familiar, of course, we have a horizontal axis, which is going to be the quantity of loanable funds, the amount of funds available to be loaned. And then this is where the price usually is. This is going to be the interest rate. And so we have demand and we have supply, just like in a number of other markets. So this is going to be the supply of loanable funds and the demand of loanable funds. The interest rate is the cost of borrowing or demanding loanable funds, and the amount of money that you pay basically for these loans. Interest rate can also be described as the rate of return from supplying these. So if you're supplying loans, if you're loaning money out, this is what you're getting back in return, the interest rate. So it's not, we're not looking at the money that you're going to getting back as a loan. So you loaned out 10,000, you're getting 10,000 back. We're looking at the amount, the price that was paid for that loan. So if you're going to collect $1,000 in interest, that is what they're talking about. A few other things to look at when it comes to this issue, loans, interest rates, and so on, is the time value of money or the future value of money. And this is important because we've talked about inflation before. Obviously, there's the value of money now and there's the value of money later. The time value of money is important to the theory of finance. And so we want to look at the impact of interest rates and inflation. And in this respect, we want to just basically assume inflation is neutral. And so we want to look at, how much it's going to be worth in the future, knowing that, of course, eventually it's going to need more money that you're going to need in order to buy things. So the time value of money is the principle that a certain currency amount of money today, right now, has a different buying power than the same amount in the future. So we all know inflation is going to happen. The present value is obviously what the price is right now, and we're also going to be concerned about the future value of it. So it's going to have a different buying power in the future. And that's something that people take in consideration. So an investor might have $1,000 and can invest it with a 5% return for a year. And a year from now, the original investment will be equal to, of course, that $1,000 times 1.05% or 1.05, because that's how we get it. We're going to have that money with an additional 5%. So we take it times 1.05, it's a 5% return. If it's a 10% return, then we take it times 1.10. So the money a year from now, that $1,000, if invested at 5%, will be $1,050. So the return would be, of course, that $50 that you're gaining in addition to the $1,000. So the time value of money is the formula in parentheses 1 plus R, close parenthesis, to T. And that is, of course, 1 plus R. R is the annual interest rate. And the close parenthesis to the T is the number of years. The present value is going to be the value of the investment at a future time divided by 1 plus R, where R is the annual interest rate, and that would be that 1 plus R is in parentheses, to the N, where N is the number of years that the investment has occurred. So there are mathematical formulas for each of these principles that we're going to figure out. Whenever we look at this, of course, we're going to be thinking about what is it valued at now and what is it going to be valued at later. And another thing we're going to be concerned about is risk. So investments return that interest, and it compensates the person that, of course, put forward that money for the time that it took for that loan to come back to them with the interest. When we say that happens, that's its maturity. And of course, there's also risk included with that as well. The risk premium compensates holders for the risks that come with the investment and that are incorporated into the rate of return or the interest rate. So that financial amount of the interest, or that percentage, if either way you want to look at it, is for administering it, the price of lending out this money, but it also includes a little bit of an insurance policy because there's a risk with loaning out. What happens if the party that you loan to is no longer able to pay it back? So the risk premium is the minimum amount of money by which the expected return on a risky asset must exceed the known return on a risk-free asset. So by which the expected return on a risky asset must exceed or go over a risk-free asset. So the risk premium is how much am I getting back on this loan that is a little risky that I made it out, as opposed to an investment I made that doesn't have any risk. So time, of course, is an important component of risk for a variety of reasons. So there's an increase in uncertainty over time. And so we are faced with the fact that as time goes by, there's a bigger risk that something could go wrong. So if we're only loaning out something for a week, that's not nearly as risky as loaning out for something like a year. So we face a lot of uncertainties, and more happen over time. So for instance, if we have an asset A and asset B, and both pay a 5% kind of interest on an annual basis, but B takes 5 years for it to be paid back, for instance, in full, and A only takes a year, with everything else equal, of course, no other variables considered, we would expect A to trade at a higher price than B, because B is for 5 years. Not as many people are going to want to take that risk. So people are more willing to pay for A because it's short term, there's not as much risk involved. So the higher price on A, though, implies, because people feel safer with it, they don't have to pay as much of a price because they're not taking as big of a risk. So there's a higher price on A because of the demand, but the price that they're getting back for it, or in this case, it's called yield. So this is a different price. The higher price originally that I mentioned is the fact that everybody's fighting over this. They want this investment because it's safer, but the compensation they're getting back for it for not taking that big of a risk, the yield is going to be low. It's going to be lower than B at least. So that's the trade-off basically. More people are going to want to invest in this particular this deal, this loan, because it's short run, and so it's a lot safer. But this other investment that they could put their money into is over 5 years, so it's riskier. Not as many people want to do it. But because there's a higher risk, there is also higher interest. They're going to be able to get a bigger yield off of it. So in that sense, the price for their risk is going to give them a greater return or yield. But of course, one of the problems is that we could make all of our investments in extremely risky types of investments. And that would ensure a greater return, unless, of course, a lot of them went broke. And so should we invest in everything that is risky? Looking at this chart here, we can see the asset return, so how much you're going to get back off of it, and then risk. So the more valuable it is, the higher risk can be. And so we can see the area below that where there's relatively low return. That's because over here there is a lower risk. And so that's kind of the trade-off. You go with safer types of investments. There's a low return, there's low risk, and then there's high return, there's high risk that takes place. But that's part of the problem. Do we want to put all of our investments knowing that they'll get high returns, but it also means that there will be high risk? Well, what happens if we lose a lot because of that? So people like to hedge their bets. They like to diversify. They like to invest in some things that are risky and some things that are not. And so this basically goes along with the phrase, not placing all your eggs in one basket. You want different types of investment just in case certain ones go bad. So whenever you put together a document for investors known as a prospectus, the document that's given to members of an investment pool that describe the institution and its basic information, what business it does. It gives all the investors a wide variety of information to make the decision. Is this something I want to put all of my eggs into? And if it looks risky, of course, you're going to have less people wanting to do it. But that's also why it has a higher rate of return, one of the reasons why. So they're going to look at this information and measure the risk premium, the minimum amount of money by which the expected return on a risky asset must exceed the known return on a risk-free asset. So how much money do I expect to make off of this risky investment when compared to one that isn't? So if it's not going to make good enough a return, then people are going to say, no, I'm not going to do that. However, there are situations where they might be willing to. Maybe they have a lot of disposable income and they're willing to take the risk. Or maybe it's because they're younger and they have more time to earn that money back if they do risk and lose it. So they're going to be looking at all the characteristics, such as risk and return. They're going to analyze the asset class. In other words, what category does it fit into when it comes to risk and return, whenever they're looking at putting together their portfolio or their overall pool of investments. And so when they're doing that, they're going to look for that risk and decide how many investments they want to make in riskier types of investments. They're going to be up here with high return and high risk, and how many they're going to make down here that are safer but bring in less of a return. So they're going to be looking at systematic risk, which is associated with each asset or investment correlated with the risk of assets in the market in general. So compared to the market of investments in general, how does this one do? That's systematic risk. There's non-systematic risk, and that's risk basically that is unique to a particular investment or the company it's associated with, and that can be offset through diversification. And a couple other terms that you might hear: capital asset pricing model. This is used to determine the required rate of return of an asset, taking into account that investment's sensitivity to non-diversifiable risk. In other words, how much should I make off of this knowing that it's an extremely sensitive, specific investment that could go belly up? How much more money am I going to make off of it? So that's something they take into consideration with what's called a capital asset pricing model. And there's also security market line. This represents the relationship between an expected return and the overall market, the systematic risk. And so that's going to show them graphically what exactly that looks like. And so the security market line is going to look like the graph on the screen now. You can see the systematic risk as it increases, and then once again at the rate of return. And you can see a grouping of dots here, the overvalued stocks and the undervalued stocks. This is a line that shows you as you go up in risk, you increase in return. The return is over here. So these stocks, for instance, are overvalued because the person involved in the assets that's investing, they're taking a risk that is way out here, but they're not really getting much of a return on it. So it's overvalued. The opposite is taking place above this. These are people that are, for instance, undervalued. So those three dots are undervalued. And the reason why that is the investor is going to get a greater return than the inherent risk than they really should get. It should be down here, but it's up here. So it's been undervalued. So the value was thought to be here, but it actually turned out to be up here. And so it was undervalued at this point. But if they're getting this rate of return, but they're actually getting this much, it means that they're overvalued. And speaking of interest, because we brought this up already, now let's talk about that, specifically defining capital, interest rates, and economic rationale. So capital refers to goods, real capital, capital assets, non-financial assets used in the production of goods and services. So basically anything that's used in the creation of wealth. So capital is important because it is a factor in the creation of wealth. Capital goods are used in the production process. So there's physical capital, which would be things that must be made by human labor, machinery, buildings, tools, and then there's natural capital. The factor of production occurs naturally in the environment, for example, land or minerals, and often we include this as a separate factor of production, just known as land. But capital is basically any product that is produced and has the ability to enhance a person's power to perform work that is economically useful. Roads are a capital, for instance. Capital is directly impacted by both interest and profit. Interest is a fee, once again, that is paid for the borrower's investment or assets. So capital itself is something that can be used for the production of other goods. It is not used up immediately in the process of production like raw materials, and it helps create an actual good itself. So there are all kinds of different types of classifications of capital. Financial capital is money basically that is liquidated, is taken to purchase things for trade. Then there's natural capital, which is the land, the natural resources that I mentioned. Social capital is goodwill or brand value, enthusiasm. Instructional capital is teaching knowledge and transferable knowledge. And then there's human capital, which includes social and instructional and individual human talent combined, what you do with your training and education. So whenever we look at capital, and in this case, when the financial system, we're talking about the money and the tools and the equipment and the education and the training, we're using that in order to produce goods and services. So whenever we make investments in these things, we are then helping to produce more. And as we just mentioned in the first part of the lecture, the interest rates are the fees that are being charged for making these investments. So the interest rate is paid by the borrower for the use of money that is then given to the lender, that then goes out to those that take the loans and purchase things with it. They purchase capital in order to produce, for instance. The interest rates guide economic rationale because it's part of monetary policy. It's how we decide to make decisions about money, because if the interest rates are high, then of course we want to loan, but we don't want to borrow. If the interest rates are low, then they're the opposite of that. We don't want to loan as much necessarily because we're not going to make as much of an investment, but people want to borrow more at that rate. The economic rationale is the explanation of the basis or fundamental reasons for something. In economics, rationale are the reasons or thought processes that impact our economic decisions. The interest rate is one of the most important primary influences of economic rationale when it comes to monetary policy and investing and saving. So the interest rate impacts a lot of what we do in the economy. And that's why it's an important part of monetary policy. And we can see here, this is using the German bank, and this is the interest rates, this is over time. We can see there's a lot of activity that happens, a lot of ups and downs over the long run. This goes from 69 the whole way to 1999. It's a 30-year time period. So when these interest rates are higher, it means that there's not as much investing that's going to be going on because people aren't going to want to borrow money and purchase capital with it. So it's possible that productivity can, of course, decline. And so we did have a recession in the early 90s. We did have a recession in the late 70s, early 80s, for instance. And 1999 and 2000, we did start to see a little bit of a dip in recession. Of course, some of that was exacerbated by 9/11. But we typically see that whenever interest rates start to go up, up, and up, it's because there's more economic activity going on. The interest rates are being pushed up naturally, or the central bank is pushing them up because they're worried about inflation. And that eventually leads to a little bit of an economic slowdown. That's one of the debatable things about central banks getting involved in raising interest rates. They can go up naturally, but if they're pushed up too much, and if the central bank is involved with that, it could end up causing economic productivity to decline too much. And so that's one of the riskier things involved in that process. And speaking of long-term investments, one of the things that we start to think more and more about as medicine and medical technology and practices become more complex but extend our lives more, we also look at healthcare and how that's kind of an investment in us personally. And so looking at healthcare and medical care, exactly what that is, where the dollars go, how that, of course, is different throughout the world, and how that impacts our overall economy are all important and expanding part of economic studies. So whenever we look at the healthcare system, there's a lot of variables that go into it. And this is an example that a flow chart, it outlines the various stakeholders or people that are invested in the broader healthcare system that exists, and some of the questions that have to be asked in order to determine policy and how healthcare impacts all of us. So what is health? What is valuable, for instance? What influences health? And there's so many different factors, just not nutrition and exercise. Then there's, of course, the demand for healthcare, people wanting to purchase the healthcare services, so not just insurance, but the actual services itself, the supply of it, what hospitals and doctors are able to put out into the marketplace, and pharmaceutical companies. And then there's the microeconomic analysis. So each of the individual parts, a doctor's salary, a particular prescription drug. There's broader planning by both the government and by healthcare institutions. And there's the evaluation of the system itself and how it's performing. And then, of course, there's the market equilibrium because, along with microeconomics, there's also supply and demand and where exactly the most efficient price and output is taking place. And we spend a lot of money in the United States and in other advanced countries. And so the question, where does all of that go exactly? And this is the percent of the total income or value of the economy, the GDP, and this is years over time. And the impact of each of these variables on that, taking up more and more of the GDP. So effective aging, you can see it's continually going to go up as the baby boomers retire and become older. The interaction of aging and excess cost growth and the effect of that excess cost growth. So the impact of all the extra spending is going to take up more and more and more of the gross domestic product. This is another reason why healthcare has to be studied more and more as time goes by. And it's not just going to be the baby boomers, it's going to be every generation after that living longer, and the longer they live, that we all live, it's going to cost more to facilitate services and doctors and prescriptions and tests and so on. And so that's why it's disconcerting. And a lot of the costs that go along with this include those from healthcare providers, hospitals and doctors, pharmaceutical companies, those that manufacture the drugs, insurance providers that are often a middleman and they have administrative costs and they have employees. There's the government's role in healthcare, which includes Medicare, which is for the elderly at this time, and Medicaid, which is for those of a lesser income. And there's the administration of all of that. Of course, all of that requires paperwork and bureaucracy, and we want to make sure no one's scamming anyone, no one's stealing, and so that involves even more paperwork. So the administrative costs also contribute to that. Something else important, though, when we're taking into consideration the costs is that some people can't afford it, and so that requires a whole nother debate about accessibility. How much should people be allowed to purchase? How much demand should go on? Should it only be if you can afford to pay for it, or is that inhumane? Do people have a human right to being treated for certain illnesses within reason? Those are all questions that, of course, are going on right now. The United States, compared to other Western advanced industrial democracies, has one of the most expensive and innovative and creative companies or healthcare systems in the world. We come up with more medicines and devices and surgeries and all kinds of other things. So one might assume then that it is incredibly effective. But here's some other statistics to look at that. This is the amount spent on healthcare in a country, and this is how many hospital beds for every 1,000 people we have. You can see by far, compared to all these other countries, we outspend them considerably. But notice we also have less hospital beds per 1,000 people than all but 2 countries. And so that means despite our spending, other countries have more beds per person. And here's also cost and then number of doctors for every 1,000 people. Now here, a few other countries have less doctors per 1,000 people, but we are still by far, we're outspending. They might be lower on the list, but we're still spending a lot more than them. We're spending a lot more than in these countries, but they have more doctors per 1,000 people. And so those are some of the concerns that people bring up about the American healthcare system. And here's another measure that is concerning. And this is showing you on the left-hand side the spending for healthcare per person. And this is life expectancy. And so you can see we spend the most per person out of these countries that have one of the lower life expectancy. Now, this is better than most countries in the world, but these other countries spend less and their life expectancy is higher. So that's another thing that's concerning. Is the money we're spending getting the best results? And even if someone is highly in favor of private sector only, for profit, or at least nonprofit, but non-government involved healthcare systems, We have that right now, but is it as effective as it could be? Does that system need reformed? Whenever we have a entity, a firm, making a product, a good or service that is then taken by the consumer, they hand over money for it. The consumption of it by that person creates an external cost or benefit, either a negative externality or a positive externality. And then the actual production of it, making of it, creates a negative externality, an external cost, or a positive externality, a benefit. And so the question is, what outweighs the other one? Are there more benefits or are there more side effects, negative side effects that cost us? And so externalities that exist, negative externalities involving healthcare that can cause more harm to the society than benefits would be infectious disease and deterioration of a healthcare infrastructure. The not as good of hospitals, years goes by without renovations or new tools or equipment. And it can also include completely unintended side effects, like the overusage of antibiotics is now creating strains of disease that are resistant toward it. And so those can be negative externalities. Positive externalities, positive impacts of the healthcare system would be health effects on wealth. Healthy workers, of course, are less likely to be absent and are more productive. So everyone having access to good healthcare will cause the economy to be more productive. The study of healthcare, technology and information, and advertising, getting the message out there, can also improve the overall economy. And things like vaccinations, for instance, or better health treatments can also help, and screenings and physicals and those kinds of things can help catch problems before they become worse and more expensive. And so in the United States right now, this outlines the voting of Congress when the Affordable Health Care Act was passed. The green areas were congressional districts of representatives that voted in favor of it. The red was people or congresspersons that voted against it. And so there obviously is a divide about how much the government should get involved. And even the Affordable Care Act, commonly known as Obamacare, was really the government just saying the private sector needs to become more involved and more efficient. So it wasn't even necessarily a public sector or a government response or taking over the industry. It was the government encouraging more private sector. But even that, of course, throughout most of the country in this red area was not something that congressional members and their constituents favored. They didn't even think that was an appropriate response of the government. So there's obviously a lot of division over whose responsibility it is to make the system more efficient and improve those results that we looked at just a bit ago. But obviously something needs to be done, and we need to invest more in healthcare, whether that's through the private sector or through the public sector. That, of course, is the debate that has to happen, and decisions have to be made by public officials based upon the elections that occur. Because here we can see the health costs per capita. They have been rising for everybody, but more so for the United States. And so the spending has been increasing per person quite significantly here in the US from year to year to year. You can see we outpace everybody else that has advanced industrial democracies. And of course, these countries all have lower populations, but remember, this is based per person. So this is a proportional rate. It isn't based on the number of people. And the Affordable Care Act, some of the things that it did that there are criticisms about in some cases, but in other cases were overwhelmingly popular. People with pre-existing conditions, insurance companies could deny them insurance in the past, but now, of course, they have to include them, but they are more expensive to insure because they are higher risk, because this goes back to the investments that the insurance company is taking money from people and it is giving it out to those that need treatment, those that need given the money that the money needs invested into. And there is a high risk with people with pre-existing conditions because they're going to need more treatment and they're going to pull more money out of the health insurance system. Changing insurance rates. The insurance agencies also can't alter their rates based on pre-existing condition. because the insurance companies would love to charge people with pre-existing conditions more. Antitrust. Insurance companies were immune to antitrust laws, and this means that they could set up monopolies, but this immunity has mostly been repealed. And so there is more competition, but some say that didn't go far enough, and more competition should occur to help bring down prices. It also closed loopholes regarding quality standards, so insurance providers couldn't reduce quality, but that, of course, that increased costs of healthcare. And it also set up healthcare.gov, a marketplace for people to go and buy insurance. And that's okay as long as there are enough competitors. If there aren't, then obviously prices are going to go up. And it did expand Medicaid in particular, but only states that were willing to go along with it. So there's been criticism from those that are more conservative politically because they say it over involves the government and expands their regulation ability too much and doesn't encourage competition and private sector activity enough. And then there are those on the more liberal side of the spectrum saying the government didn't get involved enough and that it's still relying on private sector too much. And they point out the numbers that we've looked at, of course, that prove that perhaps the American system could be better overall. So the question is, how much more investment should there be? We see how investments can be encouraged through a higher rate of return and that it can make things more productive, but how do we convince people that their health will help make them and society overall more productive? Can it just be done through educating people? So more physical education at the school level and general types of advertising that go out there that encourage people to eat healthier and exercise and so on. Or should it be involved in more direct type of investing of the public sector in making sure that everyone has the best health available? And of course, this also relates to the labor section that we talked about earlier, because obviously one of the compensations that happen with when we sell labor is benefits. If we get health insurance along with that, if we get sick days, because obviously it's better that people take time off when they're sick so they don't spread disease. And some other factors, of course, that if we are sought after, if companies really demand our labor, they're willing to compensate us with those things. But it is also, is it in the best interest of the company to offer those things to everybody so that way they have a healthier, more productive workforce? And that, of course, when left up to economic rationale, liberals will point out, well, it hasn't worked out so far. Many companies, only when they're forced to, will offer these types of benefits. Others will say, no, there are a lot of companies, many people get their insurance through their healthcare providers, so it is working. So that's part of that economic rationale, analyzing whether or not it's effective. And so these are different types of investments in capital, investments in savings, through savings, and of course, investments in people and healthcare, and whether or not those generate a great enough return. With healthcare, it's more difficult to measure because we're not actually making money off of taking care of ourselves, because it really depends upon the long-term cost. And we can't see 20 years down the road if we're going to get sick. And we can't see the big picture of everybody living healthier, because that doesn't necessarily put money directly back into our pockets like a bond would 10 years from now, or savings account interest that we're going to earn on a monthly basis. And so that's why it's a more difficult concept and more theoretical for people to follow along with.